We are safer at home. That is the word from the governor as he lowers indoor capacity limits and issues new travel warnings. It comes as another 2,200 people test positive in our state in the last 36 hours. The positivity rate continues to trend upward, but hospitalizations are down. WJZ is live. Annie Rose Ramos has more on the governor's latest announcement. Annie Rose?
Hey, Lynn, good morning. Well, the governor is asking everyone to stay home for the holidays, not to travel, and to limit those family gatherings, mainly because contact tracing shows it is the #1 spreader of this virus.
After doing so well for so long, we simply cannot afford to let our guard down over the holidays during this very critical time.
Because of the holidays, Governor Larry Hogan has ordered Marylanders to limit travel to essential purposes only. And if you travel out of state, you must obtain a negative test or self-quarantine for 10 days.
We're talking about flying out of state or traveling to places that are outside of our region. We're not going to be out there, checking people or having law enforcement come after people for traveling. We're just going to rely on the good faith of the people that are going to listen to these orders because they're critically important to keeping people alive.
The governor says gatherings should be limited to only 10 people and advises against large holiday celebrations, even though he says the post-Thanksgiving surge has not been as large as expected.
This holiday season could present perhaps our toughest challenge yet.
Hogan says the federal government urgently needs to pass a stimulus, although he acknowledges it likely won't provide help for local government services.
Which will continue to be desperately needed as we continue to battle on the front lines.
The governor is providing $180 million in economic relief, including $30 million for struggling restaurants.
To help them make it through the winter and to keep as many people on the payroll as they possibly can.
Now, the governor's new travel warnings does not apply to neighboring states like Virginia or Pennsylvania. But, Tim, another thing to mention, Mayor Brandon Scott will be speaking this afternoon at 2 p.m. to update where the city stands with COVID-19. Reporting live, I'm Annie Rose Ramos for WJZ.
Thank you, Annie Rose. 6:04 now. Moderna's coronavirus vaccine is on the verge of being approved for emergency use, making it the second vaccine designed to fight the virus. Now, it has won backing from an advisory panel after officials with the drug maker made their case virtually yesterday. It focused on the vaccine's safety and effectiveness.
The vaccine efficacy rate for symptomatic COVID-19 infection was 94.1%. We also observed a dramatic reduction in severe cases.
Now, the meeting comes after 2 healthcare workers in Alaska came down with allergic reaction to Pfizer's coronavirus vaccine. Moderna says its 2 allergic reactions during its trials were not related to shots. And unlike Pfizer's vaccine, it would not require ultra-cold freezers for storage. Now, once approved, federal officials are ready to roll out almost 8 million doses of the Moderna vaccine as early as next week.
Meanwhile, the first doses of Pfizer's COVID-19 vaccine are being given to some healthcare workers at St. Agnes Hospital. Kelsey Kushner was there as doctors and nurses got their first shots.
I'm a little nervous here, but I'm excited.
It's a big day for nurse technician Veronica Peace.
Ready?
She's the first healthcare worker at Ascension St. Agnes in southwest Baltimore to receive the COVID-19 vaccine. And with a quick prick of a needle and a round of applause,
It's done. Thank you.
she made history.
Well, when I first started working on the front line, my heart was so heavy. And now I just feel like I could save the world.
Hospital officials say they received a shipment of the Pfizer COVID-19 vaccine Thursday morning, and by afternoon, 13 of their doctors and nurses rolled up their sleeves to get their first dose.
Excited, very grateful.
Why?
I think this vaccine is going to make a huge difference.
Right now, healthcare workers, first responders, and long-term care facility patients are among the first group eligible to receive the vaccine.
I don't have any doubts. It's been well tested.
Full of mixed emotions and thoughts of each COVID patient they treated or lost.
First, I was really nervous, but I feel fine.
Some say each dose is a shot of hope the end of the pandemic is near.
I was excited because it's a step in the right direction, and it's going to make everyone feel safer.
Now, hospital officials say that today they have over 100 hospital workers signed up to get their vaccine. Reporting in Baltimore City, Kelsey Kushner for WJZ.